Hello, I'm Dr. Marla Shapiro, and I have the honor of being a past president of the Menopause Society. And today I'm joined by the medical director of the Menopause Society, Dr. Stephanie Faubion. She's well known to all of us in terms of her expertise. She's professor and chair in the Department of Medicine at the Mayo Clinic in Jacksonville, and certainly an expert in women's health. We want to talk today about a topic that is completely underestimated and often not even recognized, which is the interface of menopause and the workplace. So let's first talk about menopause symptoms in the workplace.
Great. And thanks so much for bringing this topic to light and highlighting it. I think a lot of women and a lot of medical professionals don't know anything about this. So it's important to note that menopause symptoms in the workplace are varied. It's not just hot flashes, although hot flashes are important. And it's been shown that women with severe and moderate hot flashes versus those with mild symptoms are more likely to lose work productivity, including a higher rate of absenteeism, meaning you're not showing up at work, but also a higher rate of presenteeism. And what that means is you show up at work, but you probably shouldn't have come to work because you're not feeling as well as you should to be there. So it's like you're working when you're ill, although menopause is not a disease, it's not an
Right.
illness, but it still may cause women to not function up to the level that they want to function at work. So it's not just the hot flashes. We also know that the sleep disturbances and the mood disturbances and everything else that comes with menopause are also impacting women at work. And the study that we did at the Mayo Clinic a little over a year and a half ago now have shown that the psychological symptom domain of the menopause scale that we use was the one driving women missing days of work. So it's really all of them. It's the hot flashes. It even is the genitourinary symptoms, the vaginal dryness, the urinary frequency, urinary urgency, going to the bathroom more often. Those symptoms were even significantly related to adverse work outcomes as well. So it's the whole big picture.
So let's look specifically at the notion of workplace, and can the workplace itself, and I would imagine it depends on the type of workplace and the type of work that you're doing, have the potential to influence those symptoms independently of the symptoms themselves, if you will.
Absolutely. And let's get into that a little further. But the interesting part of this is a study that came out recently showed that the type of work a woman does
Right.
really didn't matter that much in terms of still having adverse work outcomes. So, in other words, you're not safe if you have a nice, cool office job compared to manual labor job. Women in all professions still had significant issues with menopause. So, let's talk a little bit about aspects of work that can adversely impact women. So there was a recent review of 12 different studies from multiple countries with thousands and thousands of women, and they determined that environmental factors in the workplace predicted poor quality of life in the workplace. And it was working in a confined or crowded space, high levels of noise, poor workstation design, unstable work patterns like constant interruptions, and insufficient restroom facilities. So those were just some of the factors that they identified that could make a woman's experience of menopause at work worse just because of the environment.
Yeah, and we can't ignore, the fact that this is a gender-based issue in terms of who women can speak to in the workplace or bring the issue to in the workplace. If you have pneumonia and a cough and a fever, it seems
Right.
very easy to talk about those symptoms. These are symptoms that may be very difficult, particularly if your supervisor or manager is not of the same gender, to understand what is happening.
That's exactly right. And what we have to keep in mind is not all women are going to want to disclose their menopause status in the workplace. They're not going to want to go up to their supervisor or
Right.
manager and say, "Hey, I'm menopausal now." And the reason is you mentioned this is a gender issue. There is an element of ageism here and an
Right.
element of sexism here. So all of this is sort of layered in and it's more complicated because if you admit that you're menopausal at work, it implies that you are of a certain age. And therefore, does it say that you're maybe not as qualified for getting that next position or the leadership role, et cetera? So understandably, women are afraid that they might be judged in some way, and it might disadvantage them in terms of applying for the next role.
But it's almost counterintuitive because women at that stage of life have the most experience, and they're accumulating that experience to take over those types of roles. So that brings me to the question, does this limit women or some women in terms of taking that advancement or going for that advancement or pursuing that next level?
Unfortunately, I would say yes, although we have sparse data on this specifically, and I think we've just seen the tip of the iceberg here, and I think there's so much more under that. I hear the stories in my office. I had a chief medical officer of a global conglomerate come to me at the age of 52 years old, and she said, "I don't think I can do my job anymore. I think I'm going to quit." And I'm like, "Whoa, stop! Don't quit." But if that's and this is a doctor who had access to all the care in the world, and had knowledge about this. Imagine all of those women out there who don't have access, who don't have knowledge. But yes, we have some preliminary evidence that women are turning down promotions. They're taking a lateral move, or even a downward move, or even exiting the workforce altogether, because of these menopause symptoms. So I do think this is a reason for the leaky leadership pipeline that we have for women in executive and C-suite positions. But, even back it up from there, if women are leaving the workforce early, they may be jeopardizing their ability to retire. They may be jeopardizing financial security later in life. So there are many more layers to this. Never mind that they're some of the most experienced and seasoned employees that employers have. And they are the knowledge of their workforce. And if these are the most experienced people that we are losing a lot of human capital if people are actually stepping back at that
Right.
time of their lives.
So, we have women who are experiencing this, clinicians who are taking care of these women. Let's divide that up for a moment. So if you are a woman and you are employed and you are being impacted, experiencing these symptoms of menopause in the workplace, short of exiting, which we obviously don't want you to do, what can you do?
Great question. So we are assuming that probably the estimate is about 15% of employers have some sort of menopause policy in place or are considering it. So that means probably fewer than 15% actually have it. So seek out information on menopause. It may be through your employer, but it may be through other trusted resources like the Menopause Society. So
Mhm.
seek out information. Information is knowledge. Knowledge is power. That can help you navigate this experience. You can contact your human resources or occupational health department to identify any workplace policies and resources available for menopause symptoms at work, understanding that not all of them are going to be menopause specific. So, for example, as I mentioned earlier, sometimes it's the psychological symptoms, the irritability, the anxiety, the depressed mood that are getting women the most. And we already have mental health policies in place at most employers now. And so I think accessing some of these existing policies, even though it may not have the word menopause attached to it, can be
Right.
super helpful. Women can consider starting or joining an employee resource group on menopause. And it's important to understand your federal and state laws about menopause and that provide you rights and protections and may be applicable to insurance coverage and access to care.
So for clinicians who are listening to this, I think in my own practice, how proactive I am about acting and asking about symptoms of menopause, but I don't specifically take that next step to say, and how is it impacting you in the workplace if you are
Right.
working? So what can clinicians do to help women navigate this? And what should clinicians be aware of? And what should women be bringing to their clinicians to help them advocate?
Great questions. And let's just start with the fact that most healthcare professionals do not receive formal education in menopause management anymore. So your healthcare professional may have all the best intentions in the world, but may not have the tools that he or she needs to help you with this time frame. So it's important to go in armed with information about, I think I'm having menopause symptoms. I think they're impacting me in the workplace. here are some of the reasons why I think this. What are some of my options? And so if you don't have a healthcare professional that is responding to you in this way, there are other ways to access care. The Menopause Society at menopause.org has a list of certified practitioners in
But
menopause who can
let's
help.
flip it though for a second. If you are a practitioner,
Yes.
how should you be adjusting your practice? What should you be incorporating? Listen
Gotcha.
to this conversation.
Yeah, thank you for that. So I think medical professionals need to understand this association, and I think it's not well understood right now. But I think they need to be querying about women's the impact of menopause symptoms at work and how it's affecting them. And this is, keep in mind, just one piece of the whole picture of the menopause experience is how it's impacting women at work. It's also impacting relationships and everything else about a woman's life. So take it holistically, take the symptoms seriously. If the woman has taken the time to get off work, to make the appointment weeks in advance to come and see you, her symptoms are probably bothering her enough to really take seriously.
So when we think about the Menopause Society, we often have on our webpage consumers and professionals. But today we're merging this conversation because it's such a holistic conversation. Let's look at the Menopause Society and what it's doing for women, who we often think of as our consumers. And on the other side, what is it doing for our healthcare practitioners?
Right, exactly. So we have developed a consensus recommendation on menopause in the workplace that has recommendations for these different groups. So for women, for employers, for healthcare professionals, et cetera, on things that they can do. In association with that, we have developed an employer toolkit that will provide resources to employers so they have at hand those talking points, ways to communicate in a culturally competent way with their female employees who are experiencing menopause symptoms at work. So we hope that this comprehensive package for employers will be helpful for them. Women employees may actually be able to direct their employers to these resources as well. There will be things like educational sessions, webcasts, et cetera, associated with this as well. So we hope to make it a comprehensive um, place to go for both women employees and for employers to help with this situation, which we're still lacking quite a bit. As I said, only about 15% of employers actually have a policy at this time.
Well, I think it's such a call to action to women in general, all types of healthcare practitioners, to have a more global awareness, not only of menopause and menopause management, which, as you mentioned, is unfortunately lacking as much as we would like it to, but now to layer on the recommendation and the realization that for many of these women who are active in the workplace, that's an added layer of complication for them. And to be able to
Right.
navigate not only their menopausal symptoms, but their menopausal symptoms in the workplace and how the two really do interact with each other.
Right, right. And I think it's important to, for employers to take a step back and look at the policies that they have. And it may be that small adaptations are needed, but they may need to develop some programs, some educational content, et cetera, for women. So, and are they measuring it? Are they looking at really what are the outcomes? And that we have to do that before we can get to interventions that we think really work in the workplace to help women through this time. So I think there are so many things that need to be done to where we can make this a more seamless life transition for women at work.
Well, I think it's a big call to action for all of us, women who are going through the symptoms, practitioners who are helping these women navigate through the system, to recognize that where you experience these symptoms matters as well, to be able to navigate the entire. So I think you're leaving us with a call to action here, saying that, the Menopause Society recognizes how critically important this is. And if you are a woman who self-identifies as a consumer or a practitioner, come to the website, look at the tools, incorporate this in your own life and incorporate this in your clinical life if you're a practitioner, and let's move this agenda forward.
A wonderful call to action. Thank you.
Thank you so much for joining us today.
Thanks.